Hello, and welcome back to the Healthy Longevity Podcast. I'm Dr. Florence Comite, your host, and today's podcast is very exciting. We're going to discuss how to improve our heart health and longevity. And I'm excited to welcome in today's discussion my friend, Dr. David Luu, a pediatric cardiothoracic surgeon, entrepreneur, and philanthropist. Dr. Luu is president and founder of the Heart Fund, an international nonprofit organization dedicated to democratizing access to cardiovascular care and health education and advancing cardiology research and practice in low and middle income countries. He's also a phenomenal entrepreneur who recently launched Hardy.com, an online service designed to detect heart diseases, cancers, and age-related conditions early to add healthy years to your life. I met David for the first time when we were both on a healthy living panel discussion in New York City last year. We're also part of a group that David created called Longevity Docs, physicians around the world who share ideas, research, and methods for combating chronic diseases of aging. Welcome, David, and I'm delighted to spend time with you talking about your work and topics you're passionate about.
Thank you. I'm super excited to spend this time with you, Florence, and thank you for this invitation on the Healthy Longevity Podcast.
For starters, we'd love to hear more about your background and what prompted your interest in medicine. First, for our listeners, we detect a slight accent. Did you grow up in France?
Can I hide this accent?
No, it's
I don't
beautiful.
think so. That's gonna be forever. So I'm trying to make myself understandable. But yes, I'm coming from France, and from someone coming from the south of France, you have to add south of France because we're really proud coming from, the Mediterranean. So I'm coming from Nîmes. It's a really small, Roman city. And I did my medical school in Montpellier. So Montpellier is one of the first official medical school in the world. Started in the 15th century. So when you go to this medical school, it's super inspirational because it's kind of you get into the labs and then you see all those those antiques and I think it really inspired me to become a better doctor, seeing all this legacy coming from all those doctors who started there centuries ago. So yes, I'm coming from France. This is a small country in Europe. I don't know if you heard of that one.
And I've visited. I can see where, I know Europeans feel like America is still a baby because we've only been around, a very short time compared to Europe. But I had the same impression as you because at Yale, there's this big entryway where they always take pictures there, and it has a nice saying above the top. And it always made me feel that I'm in a long line of people who must have come through there. So I can't imagine the 15th century.
But you see exactly what you're saying. I think what is important is we're such a small, part of this lineage of, people trying to help, others feeling better and treat disease or prevent disease. And so I think, we are still learning, right? Imagine what we knew like centuries ago and what we think we know today and what's going to happen in the next 100 years. We have to have, this humility of saying, yes, we do our best, but yet, who knows, right?
It's inspiring, right? I say that all the time. There's inspiration and hope, but then there are days we struggle with what we don't know. We don't have answers for questions that we don't even have. And the learning curve is so steep. And yet we want to help humans live better lives.
We're using this word. Longevity has been here forever. Everyone wants to live a longer, healthier, and happier life in a way. And so, yes, the last few years I've been really pushing this world on the top of the headlines, on the media and social media. But I think, if you think about it, good medicine is looking for longevity, right? That's what is medicine for, is, we're preventing people to die from diseases by treating them. And then at some point, like every doctor should be a longevity doctor in a way.
Absolutely.
So that's it. It was like, where are we, all of us? And so why don't we do a small group where we can meet all together and then discuss what's the future and the present?
Totally agree. And yet if we could just roll the clock to an earlier stage in life and give people the tools to survive and live life to the fullest till 100, 120 because they're healthy and they feel good. Who wants to live a longer life if you're not healthy and in good shape? That's really the question to me. And that's where I started, looking at the fact that we begin to decline in our 30s. But if we could just stop aging, which to me is the biggest impact on diseases that we get in the future, we can sustain who we were at 25 or 30. Life would be fun at 100. We'd have the joie de vivre of life. So practically only my only French statement, but I did study French, David. I'd love to hear more about the heart surgery procedures and particularly in low resource countries and what you're continuing to do. What's the genesis of that, and what's the heart fund that you've established?
I think it all started with, with a personal story. I lost my dear friend and girlfriend at that time, Emily, when I was 20 years old, and so it drove me to a few months later to Africa, and so I spent a few months in Africa and Burkina Faso. At the time, I think in 2001, it was the beginning of the war with Ivory Coast, and so I was looking to help children, right? I think it was always a mission for me. My mom is a pediatric nurse. My dad is a professor of acupuncture. Treating children and then preventing disease was probably sort of my DNA. I always saw patient coming from to my home. On the Sunday, getting the care from my dad. They'll bring some food and clothes to Cambodian refugees in churches with my mom. I was not even 10. I think I was always in, I think in this environment of understanding that life is precious and your health is even more, especially when you don't have, resources. So coming back to where I was in Africa, I saw a lot of children with hydrocephaly, on those big heads coming from meningitis complication. And I realized that it was possible to help them. So I started to reach out to a lot of different surgeons in Montpellier and say, hey, would you fly over and try to treat, those children? I was 21 years old. I wasn't even, was just starting, medicine. And so I didn't know anything. So I started to bring some, intern and fellow, and I was raising funds to do that. So, and then obviously, we started to operate children for congenital malformation in different places of the world, and especially in Cambodia, where we're going into the jungle and looking at all those children with malformation. What sparked really my interest is I did a lot of rotation and executive elective clerkship in Boston and Harvard, MGH, UCLA, USC. And one day I went to the operating room and I saw open heart surgery, right? Surgeon putting a valve into a heart, changing that. I was like, wow, that's what I want to do. And so when I came back, I started to really, being focused on becoming a cardiac surgeon. And then I started the Heart Fund. I was I was 30 years old, starting, my residency in cardiac surgery. And so we went to Haiti, where after the earthquake, a lot of people couldn't access to any cardiovascular care. And so with a lot of different help and organization and people around us, we started to have this cardiovascular program. We were bringing surgeons. I was helping, those professors operating on the other part of the world. And so, again, I'm super grateful that I got trust from all those mentors, but especially, I think, from the local population. And so we operated on kids that had absolutely no resources. So what I realized is we were the only solution at some point, which, was amazing for them, but that was so limiting in a way, because if you're the only solution, if you don't come back anymore, what's happening, right? There's nothing else. And so starting to think, how can we really help people on a more sustainable way? And that's where I think preventative care and training, training people, understanding, how can we leverage tools. 2014, we started to build the first mobile clinic to go to villages and then screen people with portable EKG, portable, cardio echograph, and we built an electronic medical record. We use satellite communication to send, images to other doctors around the world. And so that's basically, the beginning of the Heart Fund. So it's still going on. We do a lot of public-private partnership with government and large organizations to fund those efforts.
It sounds like you made a real difference, and it's that kind of knowledge you can't, unless you experience it, you can transfer what you've done to help everybody. I think it's amazing to start from scratch like that and create something so magnificent out of a tragedy that you experienced with the loss of your girlfriend at the time. And then had compassionate parents who taught you from the beginning what it meant to help and make a difference. I still remember my mom making food and going to visit people in nursing homes and, wanting to spend time with them to make them feel good and compassionate, really. It makes a difference. It really does. And when you think about it from your experience, how do you see the States? Because I have a point of view that, we get a lot of care, but there's big groups of people. If you cut out the coasts, you're looking at the whole vast middle and south and north, and the kind of attention to the care they need to understand what they can do both for themselves and in partnership with medicine. Many of them don't have appropriate access to preventing disease. And so that kind of need, I think, even in a country that people feel, and it's not always true, that we have wealth in this country, but we don't necessarily have health in this country. So what can you transfer to that? Because I think that in part, it must have what led you to thinking about creating a new startup where you could help people, at all stages capture their health and stay in front of it instead of allowing disease to invade.
What is really interesting is when you're a doctor, right? And I always say that you're a doctor forever, right? Whenever you start medicine, I think is you have a mission and it's to help people. The tool that you use, they don't really matter, right? And so the tools can, it could be a nonprofit organization, it could be a startup, it could be, becoming a policymaker. I think it's really understanding what is the root cause of those systemic problems, right? If you look at it, really address those problems in three parts. There is the policy parts, right? When you live in a country like America, you have to understand what are the causes of, those chronic diseases. And I think they are really, simple to understand, right? Chronic diseases is the number one cause of death in the world, and obviously in the US as well. This is blood pressure, obesity, high cholesterol, diabetes, inflammation, stress, lack of sleep. All those components are part of the cause. And then you have the policies in place, and that's probably harder to change. And so the root of control tobacco, right, improve the management of cardiovascular disease, working with Department of Health, it's a long-term route. And so I figured out what is the easiest way you can help people. I think the easiest way is saying those are the tools you can use today to diagnose the disease that you can prevent tomorrow, right? Those are the tools that you can use today to avoid to age in a really unhealthy way. And you start with the heart, then you can add the cognition decline like early dementia, and then cancer. All those and diabetes. Those are chronic diseases that are easily detectable today with cost-effective manner. Those are the same tool. It doesn't change. So I realized that at Hearty, and the name is a little bit misleading. Everyone's like, oh, you're only treating the heart. I think, yeah, it starts with the heart because that's the first cause of death. But then when you look at one disease, then you can look at all the other ones that are related. If you only look at cardiometabolic disease, can we detect pre-diabetes and diabetes today easily? Yes. Can we treat it? Obviously, we can treat it. Heart attack, stroke, hypertension, all of those are really, easy disease to detect. Now, I think the whole mission right now of Hearty is saying, how can we avoid those diseases to appear? And to do that, you have to diagnose them. You have to detect them. And so what we do is we have a program. We have a membership program, which is totally virtual. It's a lot of things that, obviously, Florence, you've seen from the beginning. But we look at, for instance, a CT scan of the heart, right? And measure the calcium score, which is the calcium you get in the coronary arteries, the arteries that brings the oxygen blood to the muscle of your heart. And then you can tell if they're healthy or not. And so there is even AI right now with like a clearly test that can really measure before it's too late the health of those arteries. And because of that, you can act earlier. You can act before the heart attack. Exactly. And so that's the thing. Can we do that for a lot of disease? Can we do that earlier than, this 76 years old, gentleman? I think we can. And then it can start really early, even for kids. Number one prevention is education. It's for everybody.
When you show them the results deep inside, like the CT calcium score or a CT angiogram, they can't see that on the outside. They feel well. They don't know there's blockages building up or calcium deposits. And it's like unveiling what's going on at a deeper level in the body, which is a wake-up call for people that you can see pretty early. So I completely concur that that gives them, and adults and children alike, the education they need to make wiser decisions, to own responsibility for how they want to live life. It doesn't mean suffering and not having fun and not eating some of the time the ice cream or a glass of wine, here and there. But it means they have the tools to think about what are the next steps they could do to prevent a sudden heart attack. So it's very insightful, I think, if we can offer the kind of services you're talking about right at their home. It's amazing.
I think it's, first of all, every doctor should understand. That's why longevity docs is pretty interesting, because we learn from so many interesting doctors, right? We've been there on the front line every single day. So I think there's few things are really simple, right? Your blood pressure, first of all, right? Testing your blood pressure and I'm saying that for the audience, right? Blood pressure is number one. It's really cost-effective tool and it's easy to do. Everyone can do it. There's even some tools right now. Not all of them are validated, but you can get some tools that measure your blood pressure and then store everything on your phone, right? Your resting heart rate, your body composition, understanding that you have to get some muscle and less fat, right? This ratio is important. And you can even have visceral fat within your body that you don't see. So you can look skinny outside, but fat inside, right? And I know you.
Well, even skinny fat, but also I've seen people who are ripped who have fat invading their liver and that can reverse. But blood pressure, there's so many different ways. You could go into a pharmacy that has machines. You have apps on your phone, the camera on some of the phones, and you just have to make sure it's reproducible.
And then you can even go a little bit further, right? You can do advanced lipid panel, for instance, right? Understanding not only the regular cholesterol, which, it's already great to have your LDL and HDL, but going a little bit deeper. So for instance, lipoprotein A is something that, everyone eventually should test to understand if you have genetic risk of having high cholesterol, right? Hypercholesterolemia. And look, that's not something that's really costly. I don't think it's reimbursed by insurance, but anyway, lipoprotein B or triglyceride, I think everyone should know their number, but as well, for metabolism, right? You have H1 and, hemoglobin A1C, fasting glucose, fasting insulin, understanding your uric acid. And like you said, inflammation is the trigger, right? You can have cholesterol in your blood, but without inflammation, it doesn't really impact the vessel. You need inflammation to damage the vessel. So the triad is inflammation, cholesterol, and hypertension, because now it pushes it right into your blood vessel. It creates this plaque, and that's where the danger is, right? Especially when the plaque is soft and unstable. And so when we tell you 3 times a day, brush your teeth, brush your teeth, brush your teeth, it's you should as well protect your heart, right? No alcohol.
Twice a day, brush your teeth, and once a day, check your blood pressure.
Exactly.
Actually, even in my family, we all had high blood pressure, and it started with no other diseases, starting quite young. And my dad, who was very conscious of health, he started me on my journey. He was probably one of the first self-quantifiers. He made his own bran muffins. He would go for long walks. He would do races. He would race himself in the ocean because he'd walk along the ocean. He worked out in the gym. I couldn't even keep up with him in his 90s, by the way. He would go with firemen and policemen and test himself. And I would take pictures and he'd laugh at me. And then afterwards saying to me, let's go for a swim. And I was like, nope, I'm wiped. You can go for a swim. But his brain was protected up until the last moment. And yet his brother, who I knew well too, but was less vigilant and didn't really want to take the same kind of care of himself, in his 80s, he already appeared to have dementia because the high blood pressure stopped blood flow in his brain. And so it looked dementia. It wasn't dementia. It was due to high blood pressure that wasn't proactively managed. And so I completely appreciate how important that is from a cardiometabolic point of view. And you're right, it's low-hanging fruit and everybody can do something about it. The minute your pressure goes up and down, you talk to your clinician, you talk to your physician.
There's so many things, and I can go into my journey as well, but there's so many things that are accessible and are simple to implement. And we don't have to go to all those, I would say, crazy biohacking formula to get better. There's like 90% of things that are accessible. They almost, they're super cost effective. So it doesn't have to be, all those solutions for the uber rich of the world. And there is a lot of free content and education that can be distributed around that. That's for sure.
Absolutely. And that's where I think even as a wealthy nation, we don't do a good job of pulling everybody in and saying, look, these are the basics. And that's scary because I think it's pervasive in the medical community too, that you don't see a doctor or bother or spend money unless you're really sick or you have symptoms, when underneath it's brewing without symptoms. So to take a little turn, but I know it's connected to you're creating Hardy.com. I understand a few years back you had a skateboarding incident, which also changed, the way you decided to go forward in life. Can you tell us something about it? And what were you thinking skateboarding?
We moved outside of New York because they're starting to build the hospital in Central Park. We have to protect our son. So we move outside, and then we're in Long Island. What happened is I said, wow, I'm going to start and I'm going to go into the water. I want to surf. That was on my vision board, and it still is. Surfing was on my vision board. So I started, and obviously it was super cold, February. So
oh my God, you started surfing in February?
No, what I did is I said, it is freezing in February. So what I'm going to do, I'm going to go and buy a skateboard so I can train in the neighborhood.
Got it.
It lasted 2 days. So I saw that at the bike. I was following him with the skateboard, and then for some reason it was a stiff road.
Oh yeah.
Couldn't brake, and I felt on my shoulder. We compressed my clavicle and broke it in 4 pieces.
Oh my
right?
God.
It was on a Sunday. I waited, went back home. My wife was pissed, and then the next day I went. I'm going to to the hospital, to the ER. They take my blood, etc., etc. I say, hey, doc, you are due for surgery. So I see the surgeon, and I say, hey, I haven't done blood work for a long time. Can I see my result? I say, yeah, don't worry, it's fine. It's just for the anesthesiologist. Before the I say, yeah, still, send me the result. I look at the result, and my cholesterol was a little bit high, really like upper limit, and I think it was even over limit. It was not normal. And so I was like, wow, that's interesting. And that wasn't interesting. That was bad. That's what I thought. But I was surprised. Yeah, bad, interesting, surprised, because, I was skateboarding. I was always, active, playing tennis, running.
Notwithstanding the injury, you were skateboarding, right?
Exactly. But what I didn't realize is I was eating whatever I wanted because I was exercising, because I thought I was healthy, because I wasn't overweight, but still had a little bit of abdominal fat, and so at age 41, I met Dr. Frank Lipman, and Frank said, look, you have to do all those blood tests, more advanced, etc., etc. Long story short, I discovered I had lipoprotein(a), which is this marker, cholesterol marker, which basically tells you that your cholesterol is something from your family. I did as well a genetic test, an epigenetic test. God, I was like, wow, I'm aging too fast. What's happening? I have cardiovascular risk on my genetics, in my blood. I'm looking at, I have 20% of body fat. So I wasn't shaming myself. I was like, man, that's not really good for a cardiac surgeon. And so I started this journey of understanding that if I wanted to live longer and taking care of my son and my grandchildren and enjoying life to the fullest, right? Maybe not living to 120 or 150, that wasn't the point, but living to, let's say, 90 or 100.
In great shape.
Truly in great shape, like your dad, bicycling and fishing and enjoying and traveling, carrying suitcase with my, grandchildren at 90. I needed to act now at 40, to build the next 50 years. And so I started really this incredible journey to reverse my aging. And at some point, believe it or not, on biological age, we measure, for your audience, We measure, some epigenetic. We have epigenetic tests that measure the methylation of the DNA. I reversed it a little bit.
One interesting question that I think our viewers would love to hear is, what about your parents? Did any of these diseases show up in your mom, dad, grandparents? Because that's what we encourage people to tell us. I used to think of family history as a poor man's genetic test, but over the years, as genetics became better and better, I actually realized that it's actually even better than genetics in some ways because of where the field is today, because it actually shows disease that emerges. And as you mentioned, LP little a is a genetic factor. And sometimes your cholesterol can look perfect. Maybe your good stuff, the HDL is super high, your bad stuff is super low, you have the right number of particles. But if that LP little a is present, you're at high risk, and it's a hard thing to tackle. So parents, history, family history, are those things that struck you?
Yeah. Yeah, I think, my mom has, a little bit of high blood pressure. My grandparents died from heart attacks, or strokes. So it's there, right? And my dad is Chinese, so we have like those Southeast Asian genes. And so, I totally believe that there is not only the genes, like 10-20% of what makes us in terms of impact in the, age-related diseases. But I think, our lifestyle,
lifestyle exacerbates it, right? It's a marriage.
Right? But it's a marriage, right?
It's a marriage of the way, because as you said, you felt pretty healthy. You realized maybe you put on a couple of pounds around the middle, but knowing what was going on inside, which is what makes it so important, I think, to do the work that we're doing with the rest of the doctors in the world, with the focus on health. Longevity, for me, I'm not God. I don't know people's length of life. I'd like to live beyond, because I want to be with my great-great-grandchildren. I want to dance at their weddings. But the age isn't the critical part of it. It's how do you keep your health from going downhill? And you got a wake-up call. So that was really, in a way, the shoulder is something that's going to protect your life now, because you've fully started investing in what you need to do.
Exactly. And I think we have micro stressors, micro trauma, micro whatever every day, but then sometimes you have big ones. And so death of someone you love, injuries, I think they have to tell you something to inspire you to change something. And I think that's what I always use. I want to help other people to say, yeah, I'm sure you're all going through something really hard today. I know that. There's a lot of people. But if you use that to be better, to help more people, then that's really a fantastic lever. That's an opportunity to grow another person, to be kind, to have more compassion, to impact more people, to impact yourself.
Actually, totally. I can't help myself. Like, I'm in the gym this morning doing strength training and workout with a trainer. And there's a guy, I can tell from his body, he's probably around 50, that maybe a little too much wine at night. He works out to beat the band. And I gave him one of my continuous glucose monitors. And he said, my God, he had just came back from India, because he's Indian too. Mm-hmm. And he said, I can't believe it. It's really helping me make decisions about, is it tequila or is it wine or is it chicken? Exactly. And he said, the sugar goes up and down. And because I kept telling him, you can work out as hard as you want. You're not going to lose your little tummy there. And he was very grateful. And so I think just advice, because I can't help it. To me, it's so important, as you pointed out, low-hanging fruit with blood pressure, really low-hanging fruit. And we need to take the weight off the medical system, because doctors can't do that. You have to know thyself. And I still remember my dad telling me that probably 40 years ago. We were together, and he said, I go to my cardiologist because I need to spend 5 minutes with him, but how does he know me? I have to watch myself, and then I can report to him the things that might be different. Yes, I might need a prescription, but we live in our own bodies. We need to make sure that we take care of them, because we have no other place to live. And so that struck a chord in me as well. But I've heard your journey now to health span, so I'm excited to see what you've attained, and I'm happy to look at those numbers, David, with you, so to see how it's going.
No, I totally. I think, health span is something amazing. You have really lifespan, health span, number of years you live healthy. But now, I'm even coming up with something interesting that I call peak longevity, right? The investment of health span is for the next 20 years, right? 30 years, making sure you don't have cancer, Alzheimer, or heart attack in the next 20 years. Maybe 50 years, right?
Right.
But then what happened tomorrow, right? What is the peak performance? You need tomorrow, right, to get to those 50 years. And so I think it's really looking at, can we shorten this, outcome in 50 years and see the outcome tomorrow? And I think there's all those intangible. I mean, now we can measure it a little bit better. But you see stress, sleep, loneliness, community, all those kind of intangible. I think that's going to be the future.
What would you pick as the one, if anybody stopped you in the street and they said, what is the most important thing I can do to protect my health? What would you pick
Good friend.
out of all of good friends? That's
Good friends.
fascinating. And
Yeah, and they will tell you the truth. They will be here when, when you get into the deepest moment, the saddest moment of your life. That's what is the most important, right? You can have, there's this broken heart syndrome, in Japanese name called takotsudo. You can die from a heart attack because you're sad, right?
yeah,
And so I think there's an epidemic of loneliness starting in the US from social media to, like we're doing everything virtual right now. So I think at the public health level, I would say good friends is number one, right? At the personal level, I would say as well that a good friend was, and I say good friend, you have to define good friend, but someone that can tell you the truth. They will be here to hear from you. That will bring you the soup or the food if you're sick, right? That will show up when you have Alzheimer. I think those are good friends.
that's a wise answer. I'm very impressed. And I think you're absolutely right. In fact, there's data, David, that goes way back that has shown that people who have a heart attack and go home to a human being, a spouse, a partner, a friend, live longer than people who go home to a lonely, empty house. If you have a dog or a cat with unconditional love, you actually live even longer.
Exactly.
And with metastatic cancer, there are studies out of Stanford, David Spiegel, who showed that women with metastatic breast cancer, when they were part of a support group, lived 18 months longer than women who were not. I think I recognized coming to New York from Yale and New Haven, Connecticut, because people are lonely, even in a city that's so crowded. In fact, one of the parts of what I thought was my job, and I was so excited introducing people to one another. Like I had patients who I knew, because patients reveal themselves in their heart and soul, were lonely. And one of my questions when I talk to new people who want to come and see me, I ask them how close they are to their relatives. Do they see their brother? What about the children? It's very telling when people say, no, we really don't have a relationship. Things fell apart. And a lot of times in the process, if they become my clients, my patients, I will encourage them to lend a hand, that it affects their health and their stress in their body and the way they will age. Because it does.
It's an investment to keep good friends. But think about that. If you have this, this small group of friends, they are the one who you're going to exercise with, and we're going to bring you joy and reduce your stress. And I hope one day we're going to put social connection and purposeful social connection as a biomarker of health. Because right now we're looking at all the proteomics, metabolomics, and epigenetic change, which I love, which we measure. But we measure as well, social connection and your purpose. What are you driven? A lot of people say, why are you doing that? I say, I don't know. I think this is really who I am. This is in my DNA. Probably my parents sent me those genes. It's who I am. I'm a doctor. I like to do it. Obviously I want to be successful doing it because I think that has more impact. But at the end of the day, this is just who I am. This is not work. Like helping people, bringing health to the world. Health is only a tool. You have health to have a tool to live longer and to enjoy your friends. Why not?
Otherwise, if you have the health, you need to have the other pieces. So that's great.
Exactly.
What I want to turn to now is here at the Kamate Center and also our virtual app, Grok Health. We focus on a lot of biomarkers as you rattled off, and it's the interpretation, connecting the dots as I think about it, and really interpreting what's going on at a deeper level. That's why sometimes that would be hard, even for self-quantifiers. Getting the fullness of life, as you mentioned, is a where I think the best of life comes. But there are a few questions that I'd love to bring up because we have a cardiothoracic surgeon on the line. Listeners always like to ask us, specific questions that disturb them. And I'd love to have your help in answering some of the questions from listeners. I'm a 63-year-old male with no heart disease in the family, but I was prescribed Crestor for high cholesterol. I've been on it for a decade. Should I have a cardiac CT scan? And what's the difference between that and calcium score?
Yeah, so look, first of all, it's always really important to understand the whole life of this person. Yes, to answer the question is yes, but not only. I think it is really important to do, everything that includes this calcium score. A lot of people look at really the diagnostic because that's easy to understand. But again, the blood pressure is really important. Like measuring the inflammation is super important. Understanding why they have this high cholesterol. What's the level of the plaque? Is it calcified plaque? Is it unstable plaque? So maybe it will benefit to have something that's, it's a clearly and measure the soft plaque.
When you say the calcified plaque, that's the CT calcium, which is a predictor of the future risk of heart disease compared to other people. Then the CT angio gives you the unstable plaque. And then you want to take it once beyond it using AI to look at the depth of the plaque and to compare it over time. And I think that would serve, besides all the rest of it, that would serve this gentleman really well. Moving on to another one, you can relate. I'm 41 and think I'm in pretty good shape. I take a spin class, I run half marathons, I eat a healthy diet. My father had a heart attack at 60. What should I do to protect my heart health?
I mean, look, obviously you're doing everything right because, you're running marathon, etc. But that's a risk because now you don't know how healthy is your heart and yet you're running marathon. And so we see a lot of, sudden death happening in the marathon. And so I think, first of all, especially if the dad died from a heart attack or had a heart attack, is measuring why he had a heart attack. And so the only thing that you could do today, I would say, is lipoprotein A, right? Measuring LPA and then inflammation, understanding that your ApoB, so really having something that's extremely specific for the metabolic health, right? Cholesterol. Now, what was the heart attack linked to? And so that's really interesting.
He also needs to look at his whole life. How much sleep is he getting? Is it 6 to 8 hours? Is it quality sleep? What is the kind of food he's eating? He may be not living on great food for his body. Despite being a half marathon, we have people who run marathons who have stress fractures of their bones. Taking a look at what's going on there might be important too, as you pointed out. Let me give you one more. I'm a woman who's 35 and my father is alive and well. He had angioplasty. He's 80 and he's in great shape, doing well. But my mom, she died of a massive heart attack at 60. And when she went to her doctor, remember this was probably about 20 years ago or more, the doctor labeled her as empty nest syndrome and gave her some Librium or Valium. What should I do now at 35? I think I take pretty good care of myself. I try to intermittent fast. I don't eat much in the way of ice cream. I do have a glass of wine every night. What would you recommend that we tell this 35-year young woman who wants to protect her health?
So I think the most important is really understanding the whole pillars of health, right? It doesn't mean because your family had a problem that, it will happen to you, but you have to be conscious. And so I would say sleep, like you said, is super important. Understanding that you need to measure and understand your sleep. Is it 7 hours minimum of quality sleep? The type of food, understanding the food that can impact your inflammation, your cholesterol, sugar, refined, carbohydrate. Even one glass of alcohol is bad. And so people should know that alcohol is not good. Smoking, even vaping, cannabis has an impact on your cardiovascular health. Exercise, a lot of people do not exercise enough. You should at least, get 30 minutes of exercise per day, and including strength training to maintain your muscle mass, testosterone level, even for women. And what I think is really important is measuring your stress and managing it, because that's what creates a lot of inflammation as well. The food you eat and then the microbiome. I think gut health is related with brain health and heart health at some point as well. It's all interrelated.
It is. And have her take steps to one at a time, maybe to be able to explore. There's a lot of great apps out there like Aura Ring, for example, that can give you a sense of your sleep. There's even scales at home like InBody Scale that looks at your body composition, fat, and muscle distribution. That was a great answer. I really appreciate it. And I know our many listeners really loved hearing your expertise and how your takeaway on what you're doing, as well as what they can do to improve their life. I want to thank you for being on Healthy Longevity, and I look forward to more lively discussions with you and the rest of the longevity docs.
Thank you so much, Florence. Thank you for everything you're doing. You're a pioneer in the space. You inspired me and you're inspiring many others. Keep pushing. him being an innovator. I think we need more people like you, and I hope we're gonna not only democratize this movement of longevity medicine, but we can really help people tomorrow. If they have any question, happy to answer on any social as well.
Well, thank you all for listening to the podcast. I'm Dr. Florence Comite, and until next time, I'm wishing everyone a health span to match your lifespan and keep it up. Thank you.
Thank you.